This is a patient who comes in with hematuria. We do a regular CT hematuria protocol. We look at our non-contrast images. You can already start to see that the right kidney looks very, very abnormal. There's really loss of that renal sinus fat, particularly in the upper to mid-pole regions. And if you sort of window it or look at it without windowing, you can see there's lots of heterogeneity within the upper to interpolar region. The collecting system is difficult to see in that location, and the proximal right ureter also looks quite thick. Move on to our nephrographic phase, in which you can clearly see an infiltrative mass that's replacing much of the upper interpolar region of that kidney. We can see that the collecting system is essentially invaded and really difficult to see. We can also see that there's thickening of the right proximal ureter, and we can also start to appreciate some of the adenopathy in the retroperitoneal region as well. Finally, in our extirpatory phase, this is a good phase to look at the collecting system, and we can see that on the right side, portion of the calyx is slightly dilated here, and that's because more inferior to it, it's completely infiltrated and replaced by this mass that's narrowing it, causing strictures. And we see that there's hardly any excretion out into that proximal right ureter here, which is uniformly thickened. And so these findings are highly concerning for a neoplasm, given the infiltrative look to it and the invasion of the collecting systems. A urothelial neoplasm would be the top differential. This was sampled, and this indeed turned out to be a urothelial neoplasm.